There's increasing evidence for the use of relaxation and other psychological based techniques, which is utilising the brain and the brain's innate ability to control and manage pain to actually improve pain levels at the brain level. So this includes relaxation, it can include some cognitive therapies with psychologists, concepts called mindfulness, and even moving on to relaxation techniques using muscles as well. So that includes Tai Chi and yoga. The second part of helping the brain cope and manage with pain includes activating the muscle system. So increasing the tone, a regular walking regime, exercises to strengthen the muscles and the support structures of the body. There are other non-medical ways, including reducing the risks. So that might be high stress situations, smoking, poor diet, poor sleep patterns. So these are behavioural type approaches that can lead to an improved sort of body system, which appears to reduce the chance and the severity of chronic pain. It's important here to actually discuss carefully with your treating doctor or nurse practitioner, for example, your needs and what's suitable, and for you to engage and be active in choosing what's most appropriate for you. In general, a combined strategy utilising lifestyle and behavioural changes with psychological therapies with an exercise regime targeted to your problem appears to have the best long-term outcome in chronic pain. We use them routinely at times of operations and acute pain, where they appear to reduce the severity of pain. However, they're less effective in people with chronic pain, and there are various reasons for this. The first is chronic pain has a different component, and often the tissue has healed, but the pain remains, reflecting on the nervous system changes that occur in chronic pain. The second is that we get tolerance, so they're less effective in the long term. We have side effects from the opioids in the long term, and the actual pain itself changes. So the pain in chronic pain appears to be less opioid responsive. And the third problem is the long-term risks versus the benefits. So we're getting less benefit over the long term from the opioids, and there's persistence of the risk of the opioids. And that's prominent in people who are on higher doses. They have issues with their bowels, sleeping, and they can have some cognitive effects, so dizziness. So there's a potential for in the older person to be impaired and have an increased risk of falls. So in the long term for chronic pain, we look to use opioids as part of a package, and we use them carefully and judiciously, so often at a lower dose, if at all, and we look to maximise the benefit of non-opioid medications, plus physical therapies, plus psychological approaches to managing one's pain. I think it's important to speak openly with your doctor about that and to understand the place of opioids in a pain strategy for someone with chronic pain.